Albuquerque sells America a dream of desert sunsets, hot air balloons, Route 66 nostalgia, Sandia mountain beauty, turquoise skies, and southwestern culture glowing in warm colors. But beneath that postcard image, in arroyos, underpasses, parking lots, tents, shelters, and cold desert nights where fentanyl and poverty meet, another Albuquerque is rotting in plain sight while people fight to survive in the Duke City. This is Albuquerque in 2026, New Mexico's largest city, a place known for painted skies, Chile, old adobe walls, native and Hispanic culture, desert air, film sets, balloon festivals, and mountain views that make visitors stop and stare. From the outside, Albuquerque can look peaceful, spiritual, and open. The sky feels endless. The sandias turn pink at sunset. The city sells itself as a high desert escape. But for people without housing, the desert is not romantic. It is cold at night. It is exposed. It is dusty. It is hard. It is a place where a thin blanket can fail before dawn, where people sleep in tents behind businesses, in arroyos, near freeway ramps, beside empty lots, in cars, near shelters, and sometimes in places so hidden that even the official count cannot find them. Albuquerque's homeless crisis is not one crisis, it is many crises stacked together. It is the housing shortage, it is fentanyl, it is meth, it is domestic violence, it is trauma, it is mental illness, it is encampment sweeps, it is shelter pressure, it is distrust of institutions, it is families hiding instability, it is Native, Hispanic, Black, white, and multiracial residents carrying different forms of vulnerability in a city where survival can change from heat to freezing cold in the same day. And the contradiction is brutal. The same city that invites tourists to float above the desert in balloons has people sleeping below, in the dust, in the dark, asking whether anyone sees them as more than a problem to be moved. Stay with this story until the end because Albuquerque's crisis cannot be understood through one headline. Some numbers are rising, some services are expanding. The Gateway Center has become a major part of the city's response, but encampment sweeps, fentanyl, housing shortages, and hidden homelessness continue to tear through lives. This is the Albuquerque homeless crisis of 2026. One, the numbers behind the Duke City's crisis. The 2025 point in time count found 2,960 people experiencing homelessness in Albuquerque on the 22nd of January 2025. That was an 8% increase from the previous year, when the count was 2,740. Of those 2,960 people, 1,327 were in emergency shelters. Another 266 were in transitional housing, and 1,367 were unsheltered, meaning they were sleeping outside in vehicles, in tents, in abandoned buildings, or in other places not meant for human habitation. That number, 1,367 unsheltered people, is the number Albuquerque cannot ignore. It means nearly half of the people counted were outside the formal shelter system. Not just homeless, but exposed. Not just unstable, but living in places where weather, violence, drug use, police contact, medical emergencies, and displacement can strike at any moment. And even that number may be an undercount. The New Mexico Coalition to End Homelessness warned that the true scale of homelessness is likely larger than the point in time count reflects. The report explained that homelessness is hidden in many forms: couch surfing, temporary motel stays, garages, friends' homes, unsafe arrangements, and families doing everything possible to stay out of sight. It also noted that people facing homelessness are hard to survey because criminalization, trauma, distrust, and repeated displacement make them avoid visibility. In Albuquerque, the report raised a special concern. Encampment sweeps may have affected the accuracy of the count. The city agreed to pause encampment decommissioning in zones being surveyed, But volunteers still found evidence of recent clearings in some areas, making it harder to locate and survey people. That matters. Because when a city counts people after moving them, the count may not show the crisis. It may show what remains visible after the crisis has been scattered. So when Albuquerque says 2,960 people were counted, the deeper reality may be larger, more hidden, and more painful. Two, desert cold and survival after sunset. Albuquerque is in the high desert, and the high desert can deceive people. Visitors think of sun, dry air, open sky, and warm colors. But once the sun drops, the temperature can fall fast. Winter nights can become bitter. During the 2025 point in time count period, the report noted that Albuquerque's low temperature around that time was approximately 12 degrees Fahrenheit. 12 degrees. That is not mild desert weather. That is dangerous cold. For someone inside a heated home, it is a number on a weather app. For someone outside, it is a threat to the body. Cold begins with the feet, then the hands, then the knees, then the back, then the chest. Wet socks become dangerous. A thin jacket becomes useless. A blanket that felt heavy in the afternoon is no match for the night. A person may walk just to keep blood moving. They may sleep near an underpass to block the wind. They may use substances because the cold and fear become impossible to feel sober. They may sit in a car without enough gas to run the heater. This is why desert cold is so dangerous. It surprises people who think only northern cities kill with weather. Albuquerque also has heat, sun exposure, dust, and monsoon storms. But winter nights reveal a different form of danger. A person in a tent can wake up already freezing. Someone with diabetes, heart disease, infection, substance withdrawal, or mental illness may not be able to manage the cold. Someone with a disability may not be able to reach shelter. Someone with trauma may avoid crowded places. Someone with a pet or partner may refuse a shelter that separates them. For people living outside, the weather is not a season. It is a system of pressure. Three, fentanyl in the high desert. Fentanyl has changed Albuquerque's streets. New Mexico has been among the states with some of the highest overdose death rates in the country for years, and Bernalillo County has carried a major share of that burden. State health data shows New Mexico's overdose death rate has been among the highest in the nation for much of the last 2 decades, with methamphetamine and fentanyl deaths rising dramatically over time. For people experiencing homelessness, the danger is even greater. The drug supply is unpredictable. Pills can be fake, powder can be mixed, meth may be contaminated. A dose that did not kill yesterday can kill today. A person may use in a tent, an alley, a bathroom, a car, an abandoned building, or a hidden encampment where no one arrives in time. Addiction does not explain all homelessness. But in Albuquerque, addiction is deeply woven into street survival. Some people lose housing because addiction takes over. Others become addicted after the street breaks their body and mind. Some carry untreated trauma. Some are fleeing abuse. Some have chronic pain. Some are trying to silence grief. Some use because withdrawal feels like death. Some use because sleeping outside in the desert cold feels unbearable sober. People watching from a distance often ask, why don't they just stop? But stopping is not simple when life is unstable. How does someone detox without a safe bed? How does someone attend treatment without transportation? How does someone keep medication safe when belongings can be swept? How does someone answer a counselor's call when a phone is dead? How does someone stay sober while sleeping in the same encampment where trauma, fear, and drug supplies surround them? Recovery needs housing, treatment, trust, time, medical care, mental health support, case management, and a place where the person can stop living in survival mode long enough to heal. Without those things, fentanyl becomes more than a drug crisis. It becomes a housing crisis. Four, the AP investigation and the distrust around fentanyl in 2026. Albuquerque also became part of a national controversy after the Associated Press reported that current and former DEA agents alleged that federal authorities monitored large fentanyl shipments in New Mexico but did not seized them in some investigations as prosecutors sought larger cases against trafficking networks. The AP reported allegations that hundreds of thousands of fentanyl pills were allowed to hit New Mexico's streets between 2023 and 2025. One whistleblower said the strategy placed the community at risk. The DEA denied that public descriptions suggesting agents knowingly permitted fentanyl to reach communities were accurate and said the investigative decisions were lawful, reasonable, and tied to court authorized operations targeting larger drug trafficking organizations. That distinction matters. These are allegations and official responses, not a simple courtroom conclusion. Viewers should not turn them into a final verdict without the full legal record. But the story matters because it shows why people in Albuquerque are so angry and suspicious. When fentanyl is killing people, families want every pill stopped. When law enforcement says it is pursuing bigger networks, some people ask how many lives are lost while the bigger case is built. When officials say tactics were legal, grieving families may still wonder whether legality is enough. When communities already feel abandoned, a story like this becomes fuel for distrust. And that distrust enters the homelessness crisis. People living outside hear promises all the time, promises of services, promises of shelter, promises of housing, promises of treatment, promises that the system is working. But then they see friends overdose, they see camps cleared, they see belongings thrown away, they see drug supply remain everywhere. In that environment, every institution becomes suspect. The city, the police, the courts, the nonprofits, the federal government, the shelters, the outreach teams, the recovery programs. Trust is one of the hardest things to rebuild once it breaks. 5 encampment sweeps and the trauma of being moved. Albuquerque's encampment sweeps have become one of the most controversial parts of the city's homelessness response. ProPublica and New Mexico In Depth reported in 2024 that the city had discarded belongings of unhoused people, including medications, IDs, birth certificates, family photos, and even the ashes of loved ones. The reporting said the city had violated a court order and its own policies regarding the preservation of personal property. The city's cleanup crews had visited thousands of locations where people were camping, and advocates argued the sweeps caused severe harm. For the city, encampment removals are often framed as public safety, sanitation, and order. Officials face real complaints from residents and businesses. Encampments can create trash, fires, blocked sidewalks, hazardous waste, drug activity, and fear. People living nearby may feel ignored. Business owners may feel the city is failing. Parks, sidewalks, arroyos, and empty lots cannot become permanent housing systems. Those concerns are real. But for people living in camps, a sweep can be devastating. A person may lose medication, an ID, a phone, a charger, a tent, a blanket, clothes, legal paperwork, family photos, a birth certificate, a disability document, a list of appointments, the only proof of identity needed to apply for housing. A cleanup can take minutes. Rebuilding a person's survival system can take months. And when a camp is cleared without real housing, the people do not disappear. They move to another arroyo, another parking lot, another ditch, another underpass, another hidden corner where outreach workers may have a harder time finding them. This is the cycle. Camp appears, residents complain, city clears, people scatter, another camp appears, trust breaks, data becomes harder to collect, people become harder to reach. The public feels nothing is changing. Unhoused people feel hunted. A city can clean a block and still deepen the crisis. The question is not whether encampments should become permanent homes. They should not. The question is whether Albuquerque can close camps by opening doors, not just by moving tents. 6, the Gateway Center and the promise of services. Albuquerque has invested heavily in the Gateway Center, located at the former Lovelace Hospital campus on Gibson Boulevard. The city acquired the 572,000 square foot facility in 2021 and has described it as a campus for overnight beds, medical care, behavioral health, social services, housing navigation, and wraparound support. The idea is to create more than a shelter, a place where people can move toward housing, treatment, and stability. In early 2026, local reporting said the Gateway Center reached full capacity for the first time since its late 2025 expansion, serving 192 residents, including 100 women and 92 men. Officials described it as a sign that people were choosing services built for long-term stability. That is important. A shelter bed matters. Behavioral health services matter. Case management matters. A place to stabilize matters. A place where someone can connect with housing navigation instead of simply surviving another night matters. But Gateway also reveals the scale of the crisis. If Albuquerque counted 2,960 people experiencing homelessness in 2025, including 1,367 unsheltered people, then 192 residents at one center cannot carry the entire emergency. It can be a critical piece of the response, but it cannot be the whole response. A city cannot shelter its way out of a housing shortage. It needs gateway, it needs emergency beds, it needs housing navigation, it needs treatment access, it needs safe places for people to stabilize, but it also needs permanent housing, deeply affordable rentals, eviction prevention, domestic violence support, mental health care, and trust-based outreach. Without permanent exits, shelter becomes a waiting room. Without housing, services become survival management. 7. Housing pressure and the shortage beneath the crisis. New Mexico's housing crisis is severe for the lowest income renters. The National Low Income Housing Coalition's 2026 New Mexico profile found that only 41 affordable and available rental homes exist for every 100 extremely low income households. It also said New Mexico needs 40,000 more homes affordable to extremely low income households. That shortage is the foundation of the crisis. When there are only 41 homes for every 100 households at the lowest income level, 59 households are left without a true affordable option. They may overpay, double up, move to unsafe housing, live in motels, stay in cars, enter shelters, or become unsheltered. This is how homelessness begins. Not always with addiction, not always with mental illness, sometimes with rent, utilities, groceries, gas, medicine, childcare, court fees, a broken car, a lost job, a landlord decision, a domestic violence crisis, a hospital bill, one emergency, one missed month, one eviction notice. Then the slide begins: a couch, a motel, a car, a shelter, a tent. Albuquerque can be cheaper than Los Angeles or Denver and still be unaffordable to the people who already live there. Affordability is not about comparing cities. It is about whether local income can pay local rent. For a household with extremely low income, even affordable housing may be out of reach unless rental assistance is available. For someone with an eviction record, addiction history, criminal record, disability, lack of documents, or no deposit, the barriers grow even higher. This is why camps continue. Not because people want to live outside, because the housing market has too few doors they can actually open. 8. Women, domestic violence, and hidden homelessness. The 2025 PIT report highlighted domestic violence as a major factor, especially among women experiencing unsheltered homelessness. In Albuquerque, 30.3% of unsheltered women said their current housing situation was the result of domestic violence, compared with 6.9% of men. The report also found that domestic violence was reported at a higher rate among unsheltered respondents in Albuquerque than in the balance of state. This is one of the most painful parts of the crisis. For many women, homelessness is not simply poverty, it is escape. A woman may leave an abusive partner, with only a bag. She may sleep in a car because returning home is more dangerous than the street. She may avoid shelters if she fears being found. She may hide children with relatives while she sleeps outside. She may trade safety for a place to stay. She may not report what happened because shame, fear, immigration concerns, trauma, or distrust keep her silent. Domestic violence changes the meaning of shelter. A locked door can mean life. A safe address can mean survival. A confidential location can mean a future. But if beds are limited, if services are hard to access, if paperwork is complicated, or if the person has no transportation, the escape route can collapse. Women experiencing homelessness also face higher risks of exploitation, assault, trafficking, coercion, and trauma. The PIT report noted that trafficking can be a blind spot in homeless counts because people who exchange sex or take risks for a place to sleep may not be captured by official definitions. This is why hidden homelessness matters. The person the city never counts may be the person most in danger. 9. Native, Black, and poor residents in a divided crisis. Albuquerque's homelessness crisis also reflects deep racial and cultural realities. The PIT report noted that among unsheltered people in Albuquerque, American Indian or Alaska Native individuals were represented at more than double their share of the state population, and Black or African American individuals at more than triple their share of the state population. Hispanic and Latino residents also make up a large part of the city's population and are deeply affected by housing instability. These disparities did not come from nowhere. They are tied to poverty, colonial history, displacement, discrimination, health disparities, family trauma, gaps in treatment access, and uneven housing opportunity. Native people in New Mexico face unique barriers connected to jurisdiction, rural poverty, tribal community displacement, intergenerational trauma, and lack of culturally appropriate services. Black residents may face housing discrimination, criminal justice barriers, employment barriers, and generational wealth gaps. A person sleeping outside may look like one individual crisis, but behind that person may be decades of structural failure. A city cannot treat homelessness only as a matter of personal choices when the numbers show some communities are pushed into crisis far more often than others. That does not mean every individual story is the same. It means the system is not neutral. 10. Rumors, safe outdoor spaces, and the politics of survival. Whenever homelessness remains visible, rumors grow. In Albuquerque, the rumors are especially intense because the crisis touches so many visible conflicts. Encampment sweeps, safe outdoor spaces, gateway center debates, fentanyl, business complaints, lawsuits, court orders, and questions about whether the city is helping people or hiding them. Some residents claim the city only moves camps from one neighborhood to another. Some say officials care more about business corridors and tourism than human life. Some believe homelessness has become an industry, with money flowing through contractors, cleanup crews, shelters, consultants, nonprofits, developers, and political offices, while people remain outside. Others say those claims are unfair because frontline workers are exhausted, resources are limited, and the real problem is a severe housing shortage combined with addiction, mental illness, and poverty. There is no verified proof of one hidden conspiracy controlling Albuquerque's homelessness system, but the distrust itself is real. The safe outdoor space debate shows how divided the city has become. Advocates say managed spaces with bathrooms, trash service, outreach, security, and basic rules are better than unmanaged camps scattered across arroyos and sidewalks. Critics worry safe outdoor spaces normalize camping, hurt nearby businesses, reduce property values, and create safety problems. Some property owners and advocates want more flexibility. Some residents want fewer camps anywhere. Both sides claim they are protecting the city. But the question remains, what happens tonight? If there's not enough shelter, not enough housing, not enough treatment, and not enough trust, People will sleep somewhere. The choice is not between homelessness and no homelessness. The choice is between unmanaged suffering, managed temporary options, and real housing exits. A city that rejects every visible solution must still explain where people should go. 11. What Albuquerque must confront. Albuquerque is not without compassion. It has outreach workers, shelter providers, domestic violence services, native serving organizations, behavioral health providers, churches, volunteers, harm reduction workers, housing advocates, city staff, and people trying every day to help. It has Gateway. It has service providers. It has people pushing for better data, better outreach, and better shelter access. But compassion alone cannot solve a housing shortage. Albuquerque needs more deeply affordable housing, more permanent, supportive housing, more domestic violence shelter, more treatment access, more mental health services, more safe options for people with pets, partners, trauma, addiction, disabilities, and belongings, more culturally competent services for Native communities, more eviction prevention, more transparent encampment policy, more storage options when camps are cleared, more proof that sweeps lead to housing, not just displacement. Most of all, Albuquerque needs to rebuild trust. Trust between the city and unhoused residents, trust between residents and service providers, trust between business owners and policymakers, trust between advocates and law enforcement, trust between the public and the data. Because without trust, every count is questioned, every sweep is seen as cruelty, every shelter is seen as control, every policy becomes a fight, and every promise sounds temporary. Albuquerque's crisis is not impossible to understand. It is the predictable result of too few affordable homes, too much fentanyl, too much trauma, too much displacement, and too little stability. Final message. As night falls over Albuquerque, the city becomes two worlds at once. One Albuquerque glows beneath the Sandia Mountains. The desert sky turns pink. Tourists imagine balloons rising at dawn. Old town lights come on. Route 66 hums. The city looks like a place made from color, history, and open air. The other Albuquerque is colder. Someone is pulling a blanket tighter in an arroyo. Someone is hiding under an overpass. Someone is checking whether their tent survived another sweep. Someone is fighting fentanyl in a car. Someone is a woman who left violence and still has nowhere safe to go. Someone is native or black or Hispanic or white or multiracial, and all they want is a door that locks. Someone is calling for shelter. Someone is wondering whether the city sees them as human or only as a complaint. These people are not statistics. They are not trash to be cleared. They are not a threat to the desert postcard. They are Albuquerque. They are parents, elders, veterans, workers, survivors, young people, people with addiction, people with mental illness, people with trauma, and people still holding on after systems have failed them again and again. The Duke City can do better, not by pretending camps are homes, not by pretending sweeps are solutions, not by pretending fentanyl is only a law enforcement issue, not by pretending a shelter bed replaces permanent housing, but by choosing a response that protects public spaces without erasing human beings. If this story moved you, tell us in the comments. What should Albuquerque do first? Build more deeply affordable housing? Expand gateway services? Create safer, managed outdoor spaces? Stop harmful sweeps? Invest more in addiction treatment? Protect women fleeing domestic violence? Or demand more transparency from every dollar spent? If stories like this matter to you, please like this video, share your thoughts, and subscribe for more human-centered documentaries about the lives America too often overlooks. May every person sleeping outside in Albuquerque find warmth tonight. May every woman fleeing violence find a safe door. May every person battling fentanyl find one more chance to live. May every Native, Black, Hispanic, white, and multiracial neighbor without housing feel seen as fully human. May every outreach worker have the resources they need. May every policy decision remember that behind every tent is a life, not just a violation. And may Albuquerque be measured not only by its balloons, mountains, sunsets, and desert beauty, but by how fiercely it protects the people freezing beneath them.